Hi, welcome to your video for Chapter 16. This is your first chapter of your entire MBC 1135 class, which is your second diagnostic coding class. You guys made it through your very first 4 weeks of diagnostic coding. I know several of you struggled. I know most of you remember that neoplasm table and how hard that chapter was. There are going to be several more chapters in this class for the next 4 weeks, but none of them I don't believe are going to give you as much trouble as that Chapter 7 from the neoplasm table did. That being said, you are going to find a few more challenges in this class, but we are going to get through all of them just like we did the last 4 weeks. You guys actually did really, really well. So I'm very proud of you. I'm proud of how hard you worked. I'm proud of you for sticking with it. I know it seems easy just to throw your hands up in the air and say, forget it. I'm not going to be able to do this one. I'm just going to take whatever grade I get. True, false, right? I don't want you doing that. I really do want to encourage you to take the time to read every single one of these chapters. Do not just jump to the end and get to the chapter review. If you do that, you really are cheating yourself on the vital information that you need to know for how to code these. If you will work through the chapter exercises, if you will just read through the chapter, take some time, read through it, highlight it, make sure you know what they're talking about when they go through those examples, work through those examples in your code book. Don't just read it and skim over it. Actually look those up in your code book whenever they get to the examples. It will help you significantly to be able to find the codes when you do get to the chapter review. We are going to jump right into how to code these. This is your chapter for the digestive system. It does contain codes for diseases of the digestive system and accessory organs, and it is organized according to the anatomical order of the digestive system. So if you notice on the first couple chapters of your book, it actually or the first couple pages of chapter 16, it starts with your mouth. It starts with your mouth, your teeth, the salivary glands, the oral cavities. All of that is included in your digestive system. Then it goes through your hernia codes and your colitis, diseases of the intestine, your appendix, peritoneum, your gallbladder, biliary tract, your pancreas. All of those are included in this chapter. So you're going to be going over codes for all of those organs inside your body. All right, we are going to jump right in because several of you discussed or expressed, I should say, for me to be going over the codes more as opposed to what's included in the chapter. You can read through the chapter, you just need help trying to find those codes. So we are going to start with the very first one in your coding assignments. It is chronic pulpitis and it's reversible. So chronic pulpitis reversible. How would you look that up? What is your main term here? What do you actually have? You actually have pulpitis. So our main term to look up would be pulpitis. So if you look up pulpitis in your index, P-U-L, where did it go? My page I had marked was for the ends. I'm like, no, that is not correct at all. There you go. All right, pulpitis in your index, P-U-L. Past pregnancy, poisoning, right before you get to puncture, P-U-L, P-U-L. There it is, pulpitis. Notice it says acute, chronic, so our chronic is covered there, and we need to go down until we get to reversible. It gives us K04.01. So K04.01 is your code for chronic pulpitis reversible. Do not forget to go to the back and look this up. Do not just take the index's word for it. Even if it doesn't have a little check mark in the index, I still want you to go back there. I'm going to show you here in a minute in one of our case studies why you need, or in one of these coding assignments, why you have to go to the back every single time. All right, the next one we are going to do is reflux esophagitis. So what do we actually have? We have esophagitis, correct? So let's go to esophagitis, which is just inflammation of the esophagus. E-E-E. ESO Oh, come on, pages. Esophagitis. And then we have to go to reflux. It gives us K21.0. For the sake of time, I'm going to tell you that is the correct code, but I do want you to go flip back there every single time whenever you're coding these to look for these. This one you can take my word for, K21.0 is your code, but always flip to the back to look for it. And here's why. So the next one we are going to do is denture hyperplasia. So what do we actually have? Everybody has denture. There's nothing wrong with having denture. We have hyperplasia of our denture. So, and they don't mean dentures like the false teeth. They mean, if you'll look it up, the medical term for denture, you'll see what the definition is. Hyperplasia is what we're going to look up. So hyperplasia in your index. Under hyperplasia, you're going to go to denture. And this gives us K06.2. Yay, guess what? We found the code. That's not the end of our story here. So flip to, and notice in your index, K06.2 doesn't have a check mark. It doesn't have a code also. It doesn't have any note like that in your index. So if you flip to code K06.2, K06.2, it tells you, if I can find it, K06.2 in red, use additional code from chapter 20 to identify external cause of denture status Z97.2. So in order for this to be a complete code, you have to have K06.2 and Z97.2. You would not have gotten that Z code if you would not have flipped to the back and looked for those additional code notes under the K06.2. That is why it is so important to always flip to the back in the tabular section and look that code up. Do not just take the index's word for it. There are going to be notes like that for several codes, maybe not in this chapter, but in other chapters that you'll miss out on. And then you're going to start sending those emails. How did I get this one wrong? It specifically says K06.2, hyperplasia denture. Well, you're right, but you have to have a second code to make this a complete code. So make sure you're always flipping to the back. I know you've heard me say that a million times. You'll hear it again before you're done with this class. Trust me, but you have to. All right, we're going to move on to the case studies. So for case study 1, this is pretty easy. It gives you the impression. The impression says diverticulitis with hemorrhage. So your impression is, this is our diagnosis. This is what the doctor is saying his abdominal pain is caused from. So even if you just skip down to where it says impression, that's what we're coding, diverticulitis with hemorrhage. So for this one, you're going to look up diverticulitis and then intestine with bleeding. So let's flip to diverticulitis in the index. D-I-V. Oh, come on. D-I-V-E-R. Diverticulitis with bleeding. And it's going to give you we have to go intestine and then bleeding. So diverticulitis, intestine with bleeding. So diverticulitis, intestine with, and then bleeding. And that is how you're going to find this code. I'm not going to tell you the code. I'm not going to give it to you. I'm just going to help you find how to find these. So the next one we're going to do is case study 2. Again, it has the word there, impression and plan. It says exacerbation of ulcerative colitis with rectal bleeding. Admit patient at this time. Would like to start IV rehydration, also intravenous steroids. Will observe stool count, consistency, and whether there is blood in the stool. Amylase, creatine, bun, white blood cell count, HDB, and MCV are ordered. Those are all pathology codes. So we are just coding for the diagnosis. We are not coding for what they actually did. The diagnosis is ulcerative colitis with rectal bleeding. So we have to reference the main term colitis. Then under colitis, you see ulcerative chronic with rectal bleeding, and it gives you a code. There is one code for this one. Okay, the next one we are going to do is case study 5, ED summary, which is emergency department summary. It says, Kyle presented to the ED with abdominal distension and tenderness, a fever of 102, and complaint of nausea. Kyle has a history of perforated peptic ulcer. If you guys know anything, if you remember anything from that last class, if you see that word history, you're going to have to code the history of what it is. But your history code will come second. The physical exam was performed along with arterial blood gases, which showed lowered potassium and carbon dioxide, urinalysis, and lab tests, all of which confirmed the diagnosis of generalized acute peritonitis. So this one you have to code acute peritonitis first. So we go to peritonitis. Notice all these words are in parentheses whenever you look this up in the index, and then acute, and we find our code. It begins with a K for your first code. Your second code, you have to go to history, then personal, disease or disorder of the digestive system, peptic ulcer disease. That's where you're going to find your history code. So it's a personal history of perforated peptic ulcer, which is a disease of the digestive system. So history, personal, disease or disorder of the digestive system, peptic ulcer. That's how you're going to find your history code. All right, so for the rest of these, I think you can handle it. I think you'll be able to figure out what it is that you need to code. If you have any questions, you guys know the drill. You have to ask them or I can't answer them. Your password for the Chapter 16 video quiz and the Chapter 16 review is diverticulitis. DIVERTICULITIS. Diverticulitis is your password for Chapter 16. All right, that's actually all I have for you guys. If you have questions, make sure you let us know. Let your instructor know, whether that's me, whether that's Desiree, either one of us, whichever one's teaching your class. Just send us an email. We'll be happy to answer your questions. Bye, guys. Good luck for the rest of the week.